Hi, this is Nurse Amy, and I'm going to talk to you today about diabetes insipidus. Now, one of the things that makes diabetes insipidus so confusing for people is the word diabetes. So, people worry about like diabetes type 1, diabetes type 2, and then suddenly they bring into the mix diabetes insipidus, and it gets confusing because of type 1 and type 2 diabetes, where diabetes insipidus is something totally different. It doesn't have to do with the pancreas or insulin. It has to do with ADH, which is anti-diuretic hormone. So I'm going to use my whiteboard today. Hopefully that helps kind of consolidate and help things make a little bit more sense. So bring my little whiteboard over here. So diabetes insipidus has to do with anti-diuretic hormone. So anti-diuretic hormone comes from your posterior pituitary gland. And it's exactly what it says it is, anti-diuretic. So a diuretic makes it so you pee a lot, okay? An anti-diuretic makes it so you don't pee a lot. But what happens with diabetes insipidus is there is a decreased secretion of anti-diuretic hormone. So if we have a decreased secretion of anti-diuretic hormone, we're not going to be concentrating urine. So with diabetes insipidus, you're going to be peeing a whole lot, okay? So let's talk about first what makes this happen. So there's a few different things that can actually cause diabetes insipidus to happen. So it could be head trauma. It could be idiopathic. So like an autoimmune disease, something like that. It could be that somebody had intracranial surgery. That's not how you spell surgery. Let's change that last G to a Y. Okay. Because I do know how to spell. So intracranial, that's not how you spell intra either. I do know how to spell. So intracranial surgery could also be the cause of DI. So these are some things that can actually trigger diabetes insipidus into happening. So if there is a lack of anti-diuretic, it means that people are going to pee off a lot. So signs and symptoms. I'm going to erase this. Signs and symptoms. Let's go for red. Signs and symptoms then, I already said, peeing a whole lot, okay? So polyuria. Poly means a whole lot. Urea means pee, okay? So polyuria, lots of pee, okay? Another symptom that we can see, polydipsia. Poly, once again, we already have established a whole lot. Dipsia is drinking. So people are going to be really thirsty, which means they're going to be drinking a lot, okay? Another thing you're going to see is nocturia. Nacht means night. So peeing in the middle of the night, people like their sleep. Nocturia, not so fun of a symptom to have. Getting up in the middle of the night, peeing a lot. Another thing we're going to see is hemoconcentration. Now, the reason why we're going to see hemoconcentration, let's think about this. If you're peeing off your water, it's coming out of your veins, right? So it's going to concentrate your blood because you're peeing off the water, which leaves your blood vessels dry. Okay? So it's going to concentrate your blood, which is going to leave your hematocrit high, your hemoglobin high. It's going to concentrate your blood. Now, if it gets really bad, guess what can happen to your blood vessels? They can collapse. Okay, if it gets really severe. That's bad news. Super bad news. Okay? It can cause hypotension. Because if I don't have blood to work with, your blood pressure is going to be like, okay? It's going to be super sad because your heart is going to be like, I don't have anything to work with. I don't have anything to pump. So you're going to have low blood pressure. Tachycardia. And why do we have tachycardia? Because your heart's going to be like beating super fast, at least initially, till your body's like, man, I can't keep going, right? So initially you're going to have tachycardia because you're going to be like, man, I have to keep working hard. So you're going to have tachycardia. Your heart rate's going to go up really high because there's nothing to work with. So you're going to go into like survival mode, emergency mode, and go up really high to try and keep pumping that blood as fast as it can around the body. It's also going to be trying to circulate oxygen as fast as it can. Okay? So tachycardia. Okay? Skin tenting, because you're dry. Fatigue, those kind of things. So anything along those lines are things you're going to see with DI. Okay? All right. So these are the signs and symptoms along this line that we're going to see with DI. Now, how do we diagnose it? Let's scout out a blue one for diagnosis. If my blue one wants to work. Diagnosis. One of the things we can diagnose it with, or by rather, is serum and urine electrolytes. Because we can check and see what those levels are. Am I peeing off a ton of potassium? Because we pee off a lot of potassium. Can cause us to become hypokalemic, okay? Can cause us to become hyponatremic, okay? What about my serum and urine osmolality? What is that looking like? Okay. What about my urine and my urine specific gravity? Urine specific gravity is an excellent and accurate way of checking hydration status. So if it's very dilute, That's a great way of checking diabetes insipidus. So we're looking for anything that's less than 1.005. Okay. We can also check a CT and MRI of the head. To see if there's something going on with the pituitary gland. Maybe there's a tumor. Okay. If you've got a tumor on your pituitary gland, it can definitely cause problems with your ADH, okay, and trigger diabetes insipidus. You could also do a water deprivation test. Where you don't give water to your patient, and if it, what does it do to your serum and urine osmolality? And you check to see how it affects everything, okay? So, diagnosis, okay? What about treatment? What are we going to do to treat diabetes insipidus? For treatment, we want to try and elevate initially and then maintain your fluid volume. When you're doing that, if you're replacing, say, with like NS, you need to watch that sodium level. If somebody is conscious and aware, you can have them drink fluids, and it's usually a great way of replacing what is lost. Monitoring the electrolytes. You want to make sure you're monitoring those to make sure they don't go too low, too high in that replacement process. Also, you want to administer synthetic ADH, and this can be in the form of desmopressin or vasopressin. Because you still have to replace that ADH. You can't just give water and be like, hope it works. Okay, you still have to do something to replace that ADH because the pituitary gland is still messed up. Okay, so you have to do something to fix it. Okay, so I hope this helps with your understanding of diabetes insipidus. And always remember, this isn't to help diagnose yourself or anyone else with diabetes insipidus. It's just to help I hope it helps you study and understand diabetes insipidus. Also, you can check out my Facebook page at Study Nursing with Nurse Amy. Thanks for watching.